Hey everyone, hope you're all enjoying the beautiful weather this bank holiday weekend. So just going to answer the couple of questions that we got in from the Q&A. So just hope not only these people that asked the questions but other people might get some good information and advice from it. So first one came in about best exercises or stretches to do for someone that's desk-based at work. So again, look, quickly we'll say there's no such thing as an ideal posture in this world. We talk about being nice and straight and all this. Ideal posture is just constantly change and move, and that's what our body craves that movement for. But for anyone that is desk-based, just a couple of quick tips. You want to make sure that your seat, when you're sitting, that your knee, hip, a nice 90-degree angle. Same with your elbow when you're on a computer like that. Your eyes should be looking down slightly at the top of the screen as well, just from screen levels, and your mouse isn't too far away, or the phone, so you're not going to move too far away. So a couple of easy ones. So because we know you're more likely desk-based, you're more likely to be kind of rounded in and kind of a bit more like in this position. So all we're going to do from a movement point of view is just take you out of those positions. So a couple of easy ones is just literally coming back and just pulling the shoulder blades in together like that. You can also hands behind the head, arching back like that. You can come down to the side like that. Really good one for anyone who gets tension in the neck, just kind of rolling the shoulders up and down, just releasing that tension. And then a nice one for the middle of the back and around the shoulder blades. You're just going to reach down like this, and then you're going to stretch up and over, just not forcing anything, just working within what's comfortable for you. So yeah, they're probably some of the best ones. Just move often, really. That's the best thing you can do. So second question we got in was someone that has some tendon pain in the elbow. So again, it could be a lot of different reasons why this has occurred. So basically what the main reason it tends to happen is because there's an overload on some of the muscles around the elbow. So bricklayers, block layers tend to get it, or people that are quite manual. Office-based people tend to get it as well because of a lot of the keyboard typing work. So if you've got what we call tennis elbow, you'll more than likely have more pain in the forearm muscles here. If it's the opposite, it's called golfer's elbow, you'll tend to get some pain here and coming along down this side. So we used to think, or people were of the perception that it was an inflammation, the tendon was inflamed. Research has shown that that's not quite true, so it's more of a little bit of micro trauma or a little bit of degeneration within that tendon. So best kind of exercises to do for that is you can do a nice gentle stretch like that. If it's the tennis elbow, pulling back like that. I'm going to hold that for 20-30 seconds and do 2 or 3 of those. But what's most important, if the person is very sore, what they can do is just pop their arm across their on their knee like that, and then you're just going to bring your wrist up a little bit like that. Excuse my nice gammy finger there. So you're going to be pushing down and pulling up at the same time gently. So what that will do will fire up these muscles and just try and reduce some of that pain. So you might hold that for 40-50 seconds, just nice and gentle. You're not pushing maximally, just nice and controlled. So you do that 3 or 4 times. Other options like dry needling, acupuncture, stuff like that is quite good for pain relief as well, which we offer. And the big thing is just trying not to do too much and overwork those muscles. So I suppose just being conscious of those things with your work. If it's something you can change, then seek us out for some input to try and get control back over that. And then the last one we had in was about ACL. So we had a guy who's had his ACL surgically repaired for a rupture I'd say just over a year ago. So what his problem is, he's saying that when he runs, he feels his good leg is really tired and get tight and all that. So what that would suggest, hard to know exactly without obviously assessing it, but what that would suggest is that either there's still some weakness in that operated side, or else it could be that the body just still isn't comfortable or confident in putting that full weight in it. So it could be the brain is kind of saying, oh, I'm not too comfortable with that, and when you run you shift extra weight over onto that good side. So best thing you could do is kind of really test the power right and left, or probably what would be quite good as well too is really slowing down the running and being conscious of taking equal weight each side. If that means you go a little bit slower for a while and you build it up, that's better than overloading the opposite side and then something starts to give on that side. So again, hard to know exactly without an assessment, but they're kind of the basics for getting those right. So hope that provides you with some value. If anyone else has any other questions or comments or anything, just feel free to give us a shout. But we'll make this a weekly thing and just try to get some good content and advice out there for you. So see you later. Bye.